My name is Amber Ray, and for my second video submission, I'm going to be discussing the rabies virus. In the picture to the right here, it has the rabies virus. You can see has different kind of proteins that it encodes, an RNA center, and then an envelope around the outside. So what is the rabies virus? Rabies is a viral infection that it can be deadly if not treated in time, and is mainly spread by infected animals. As you can see in this picture over here, if you were to look at it under a microscope, this is what you would see. The virus is bullet shaped. You can see the different bullet types around. It is classified in the Rhabdoviridae family, and the virus encodes 5 different proteins. I'm going to switch back to this other picture here. You can see the different proteins a little better. The N protein is a nucleoprotein. The P protein is phosphoprotein. The M protein is a matrix protein. The G protein is a glycoprotein. And the L protein is a polymerase. And of course the RNA center with the envelope. So how exactly does rabies spread to other organisms? The infection can be spread by dogs, bats, raccoons, foxes, skunks, and those are just in our area. In different parts of the world, it can be spread by their popular animals. So how can you get it? The virus is carried in the saliva and enters the body through a bite or through the broken skin. It travels from the wound site to the brain. Once it reaches the brain, it causes the brain to swell, and the swelling of the brain causes other symptoms to become apparent. It at first attacks the central nervous system, and then eventually, if the symptoms progress far enough, it will reach your peripheral nervous system. As you can see in the picture here, dog bites the skin, and then that sends the virus into the brain, and it causes the brain to swell into the cavity. So what are the symptoms? You can have swelling, inflammation, excessive drooling, loss of muscle function, low fever, muscle spasms, numbness, tingling, restlessness, or difficulty swallowing. You can see how this relates to the brain swelling, with your loss of muscle function, your low fever, numbness, things like that. From the time the infection enters the body to the time you start showing signs, this period is known as the incubation period. On average, this period lasts somewhere between 3 to 8 weeks for most cases, but that's just an average. The symptoms can show up as early as 9 days, or they can take several years to show up in some really rare cases. As you can see, excessive drooling in the picture here. So, diagnosis. If you're bitten, you should gather as much information about the animal as possible, and make sure to call the local animal control center so that they can capture the animal. If rabies is a possibility, the animal will be monitored. You should see a medical professional and allow them to cleanse the wound properly and then proceed medical treatment from there. Most likely, if you suspect that the animal was positive for rabies, they will give you the vaccine and a tetanus shot. And for animals, they can use the immunofluorescence test, and this is done on the animal after it has already been dead. They use the brain tissue to reveal if the animal is positive for the infection. This immunofluorescence test is also known as the direct fluorescent antibody test. Basically, if it's positive, the slide will show up with fluorescent light. If it is negative, then it won't show up with fluorescence. The same test can be done for humans, but it will be done using a small piece of the skin from the neck. The doctors may choose to proceed after that test is done with a saliva test or a spinal tap test. Since the virus infects the central nervous system first, then it should be in the spinal fluid if you're positive for rabies. Is there a treatment? The wound should be cleaned properly. If there's a risk of rabies, they will give you a preventative vaccine, and the vaccine will consist of 5 doses given over a 28-day period. The HRIG treatment, which is the human rabies immunoglobulin treatment, that is given the day of the bite. The protocol for this is known as the post-exposure prophylaxis. Immunizations and treatment for possible rabies, they're recommended up to 14 days after the bite. And once the symptoms start to appear, survival is very rare. If it's left untreated, the virus will advance aggressively into the body. You could start showing extreme signs, and those signs could lead to paralyzation of the body, induce a coma, or ultimately death in the end. That's really important for you once you've been bitten or scratched by any kind of wild animal or any animal that you suspect could be carrying the rabies virus, to go and get treated that day. You don't want to let it sit and not let the medicine have the full effect. So, how can you prevent it? So far, no one has in the United States developed a rabies infection when they are given the vaccine in a timely manner. You should be sure to avoid contact with animals you are unsure of. Don't try to go and pick up random animals off the side of the road that are showing signs. You should get vaccinated if you are in a high-risk occupation, like if you're a vet or a veterinarian aide, or if you travel to other countries often. Sometimes they have different types of common animals there, and you never know what you could be carried. You should ask your veterinarian about immunizations for your pet. This is pretty important, especially if they're an outside dog all the time and they're interacting with other animals. Make sure you get them immunized. And this is all that I have for the rabies virus. If you would like to use this video, Dr. Blair, you are more than welcome to.